Breaking news! We're live here in Washington, D.C., where Donald Trump just announced that the United States will be moving towards a national health insurance model.
This model is brought to you by our fellow neighbors up north.
This decision to adopt Canada's model stems from a desire for a universal healthcare system and equal access to care.
Canada has a low infant mortality rate and a high life expectancy.
According to who?
Who?
The World Health Organization. They state that Canada is ranked 30th in the world for healthcare quality.
Well, how does that compare to the United States?
Well, the United States is actually ranked 37th in healthcare quality.
Let's talk more about Medicare. Medicare works like a single-payer system, but in actuality it is a 13-payer system because each province and territory sets up its own Medicare program.
So if this was implemented in the United States, it would be similar to each state having its own healthcare program.
But to ensure equality across the country, the Canada Health Act was set forth. This act sets national regulations that each province and territory must follow in order to receive federal funding.
Similarly, the United States is currently working towards a program that regulates healthcare at a federal level.
Now, one question many Americans have asked is whether the transition will affect the training of healthcare providers. But actually, education and training in Canada is similar to the United States. Future general practitioners must complete undergraduate schooling, take the MCAT, and go 4 years of medical school that is followed by another 4 to 7 years of residency. With that being said, the United States does not see a need to change our current training for healthcare providers. Implementation of Canada's healthcare has a few other aspects to consider.
To speak on this topic, we have Senator Jones from Kentucky.
She's going to give us some insight on this new transition, specifically cultural influences and identification of disparities.
The senators here in D.C. have been looking at disparities in the Canadian healthcare model in order to combat some of the challenges that might come with the new system. Wait times are the center of the debate. It is important to note that these wait times are associated with elective or non-urgent care. Wait times for primary and emergency care are similar to that of the United States. Another disparity that Canadians face is a shortage of doctors and nurses due to lack of compensation. The American government does not plan to cut medical professional salaries, so this should not be a problem for the United States. Now looking to cultural influences on healthcare practices and trends. Much like the United States, Canada's healthcare is dominated by Western biomedical practices. Canada is sometimes called an egalitarianism society, which means that they deem all people are equal, which is why Canadians chose a model of healthcare that includes universal coverage and equal rights and opportunities, regardless of gender, age, race, or beliefs. All in all, the transition is going smoothly. There will only be a few adjustments to the Canadian healthcare model to better fit American culture.
Thank you, Senator Jones.
Yes, great insight. Next up, a mother's first-hand experience on Canada's healthcare system and her thoughts on its implementation in the United States.
Hi, I'm Candace, and this is my daughter, and we're here to talk about our experience with Canada's national health insurance model. I can't wait until the United States gets the national health insurance model. Canada's health insurance saved my baby girl. I'm a single working mother of 3, so paying for insurance out of my small income would be very difficult. My youngest daughter got really sick a few months ago and needed to have an emergency kidney transplant. In the United States, this surgery would have been quite costly, putting a huge financial burden on me. My daughter had to stay in the hospital for a week post-surgery and then another 8 weeks recovering at home. During this time, I was unable to go to work, which meant I got behind on a lot of the bills. With the national health insurance model, my daughter was able to get her transplant at no cost to me. I couldn't be more thankful for the system that Canada has in place. Without it, I might have just lost my baby girl.
I'm so lucky that my mom got to stay home from work to take care of me. I feel so much better, and that's all thanks to her.
What a heartwarming story, Candace.
Yes, very touching.
Well, there you have it, folks.
As you can see, Canada's system has proven to be effective. They provide universal health care at a low cost.
We are excited that President Trump has taken this opportunity to provide better quality health care to all Americans by moving towards Canada's healthcare model.
Well, that is all we have for tonight.
Thanks for watching XYZ, LL, LMAO, XXL, PSQ, hashtag RLFO. I'm Queen Latifah.
And I'm LeBron James.
Have a great night, DC.